Hello, my name is Dr. Susan Stukes, and I'm going to be talking with you about oral health and how you can use the information you find in the mouth to help support you in your community health work, and also how you play a role in actually providing oral health coaching that so many patients really need to improve the quality of their life. Objectives are going to be, first and foremost, to quickly show you how to assess the oral health of your patients in a way that will help you recognize some red flags. And then from that, also provide you with the information you're going to need to help coach or guide your patient and refer them not just for oral health support, but for other avenues of support that you might realize from the oral health assessment, your SMILE protocol. And all of this would then lead to improved access for access to oral health care for your patients. Again, my name is Dr. Susan Stukes, and I've been doing dentistry for over 35 years, and I use a whole health approach, which is I always try to find the connections that the mouth has to the rest of the body so I can educate and empower my patients. And I hope that's what you will learn to do as well. And I spent most of my career working for the underserved. I have provided health care in all kinds of settings, from here to Africa, the Caribbean, Central America. I also have provided health care for migrant workers, for domestic violence survivors, recovering addicts, the homeless, foster care children, in the prison setting, and even the military. And now I run a dental program for a community health center. So I have a pretty good idea of the challenges that many of your clients face and the challenges that you have trying to support and serve them. Okay, and I devised the 90-second SMILE protocol because as an oral health person, we really need to work together. And I understand that some of the training that is out there to help non-dental professionals is training that has not made it easier for you to use. So I wanted to put together something that I hope will make it easier for you and make you feel more comfortable about looking in the mouth and learning all you can from the mouth. Lisa is a patient I like to share about because it shows that education and empowering the patient, but also showing them how their overall health affects their mouth, is the story I'd like to share with Lisa about Lisa. Lisa is a patient. She's in her 50s, and she's got lupus. And she came in, and her gums were red and bleeding, and her teeth were loose. She was uncomfortable. She didn't like smiling, and I immediately, started to teach her about her lupus and how the bacteria in her mouth was beginning to overgrow and was causing her this terrible inflammation. And that simple things that she could do, oral health wise or hygiene wise, that could make a difference. And as she started to try some of the things that I was sharing with her, in addition to brushing and flossing, she saw in a short period of time such an improvement in her tissues. She is such a different person now. She's happy. She said she was really, she was getting kind of down because she felt so uncomfortable, and she, just was having so many difficulties. But now she's back to being herself, and a lot of that had to do with empowering her to learn more about her body and also to be able to take care of her smile better. So I share that story because it relates to this quote, which is, oral health is a reflection of your physiological, social, and psychological factors that are essential to quality of life. And that was the case with Lisa. She had a medical condition, which was affecting her smile. And the two together were just, a lot. And the mouth was uncomfortable. So that affected her socially. It affected her quality of life, and it affected her psychologically. So she's a good example of how all these things tie together to affect how your patients, feel every day, and it affects how they perform and go through life to live as fully as they can. So in that line, this type of thinking, it causes us to kind of shift a bit, because I know when you're not a dental professional, a lot of times we default to, I have to give a dental referral, and we don't really look at it as oral health. So when we look at a person and we say, the only thing I'm thinking is refer them to the dentist. Well, that kind of limits how, you can find yourself integrating into this world of oral health, because you're not a dentist, and you're not going to be learning how to get in there and diagnosing and preventing and all that stuff like that. So from that perspective, it kind of is intimidating. And so a lot of people just, they don't want to, they feel like it's too much. And so the whole conversation of taking steps to integrate, becomes overwhelming in your mind. But when you look at it as oral health, not dentistry, oral health, just like you would look at skin health or heart health or any other kind of health for the body. The oral health, and what impacts your oral health is what impacts the rest of your body. So just as you support your patients in these other aspects of their health, now you can support them in the oral health aspect of their lives. Because definitely, as I was sharing, quality life is a huge one. But a lot of your patients, they lose days at work, days in school. Their smiling is difficult, speaking, showing emotions, all those things are affected. And those are all avenues that you could see yourself supporting your patients, versus how can I support my patient in dentistry? That's a tough one. And why it's so important is because oral health is connected to, as we were sharing, all levels of the person's being. But when you get down more into like clinical things, oral health is really tied to heart health, diabetes management, kidney health, mental health, the health of compromised patients. Oral health is connected, as we were saying, on the broader level to us, our quality of life, our physiological, social, and psychological lives. That when we talk about the physical aspect of oral health and what it's all, the connections, then you get down into systems in the body. So the heart, your circulation, your nervous system, and all those things. It's all, the oral health affects all of that. The social determinants of health. This is where, the community health worker, now this is your arena. And oral health and these social determinants of health that you're familiar with, they're all the same. What determines oral health? Well, of course, nutrition, access to healthcare, education, learning about how you can take care of your mouth, money. Can you afford to go to the dentist? Stresses affects the mouth. All those social determinants of health are the same determinants of oral health. So now when we look at it like that, well, of course you can integrate oral health into what you do. Why it's important? Well, oral health status affects everybody. A lot of times when we talk about oral health, we seem to think it's just people who are, economically disadvantaged. But from these statistics, oral health and the need for oral health and oral health coaching and support and referral, that cuts across all economic and social uh, targets, all of them. If you look at these statistics, 33% of Americans, adults, have not seen a dentist in the past year. 33%. 64.7 million adults over 30 have gum disease. 64 million. And 70 million adults over 65 have gum disease. So that's a lot of people. And when we're thinking about assessing people for oral health, I would say don't limit it to a person that may not have insurance or what you might think a person that might need oral health. You make the assumption that everyone could benefit from oral health and oral health coaching and oral health education, everyone. Because if you look at these numbers, that's it. That's pretty much, large population. Children are in need of oral health. Cavities are the most common chronic infectious health problem. And children with cavities, is 5 times more common than asthma. So children, okay. Seniors. Seniors are a lot of times overlooked, but seniors, because most seniors have Medicare. Medicare does not cover dental. And as you get older, of course, all kinds of medical conditions that you have, and those medical conditions have an impact on your mouth. And the mouth has an impact on the medical conditions. If you can't chew right, you can't swallow your food. And from these figures, these statistics, you're seeing 40% of seniors do not have a yearly dental visit. 60% have gum disease. They're 7 times more likely to have oral cancer. 15% avoid foods because of dental problems. And seniors are at a higher risk for diabetes, heart disease, malnourishment, weight loss, or obesity. And all of these things can be tied to seniors and their oral health. So it's a very important aspect of the quality of life of your clients. Your chronically ill patients, a lot of our patients, especially as they get older, have some type of chronic illness, diabetes, heart disease, respiratory cancer, renal disease, and all of these people, the connection between their medical condition and their mouth is a strong one. And if any of these things, if the mouth is off and there's too much bacteria in the mouth, it could affect their outcomes with their chronic illnesses. Pregnant women, it's been shown low-term birth weights. Here again, the diabetic patients, it's been shown that it is the 6th complication of diabetes. So it's very, very prevalent, diabetes and gum disease. And what they found was by treating gum disease, you could actually lower a person's A1C by 1%. And that 1% relates to a reduction in diabetes-related deaths by 21%. So by focusing on the mouth and identifying these high-risk patients and us giving them not just the dental care, but the oral health coaching and support and education they need can really make a difference in people's lives. The barriers to oral health care, some of them which we highlighted with the social determinants of health, but cost, money, that's a huge one. If a person doesn't have insurance, and even with insurance, dentistry can be very expensive. Access, social determinant of health, transportation, distance to a provider. These are things that are It can be an issue in oral health. If you live in the rural areas, it may be long distances between you and your client and a dentist. Or you might have a lot of dentists around you, but maybe they don't take the insurance that your patients have. Fear, of course, a lot that keeps a lot of people from go seeking care, and lack of knowledge. Now, the fear, the lack of knowledge, those are areas that by you working with us and by you feeling comfortable learning what you can from the mouth and being able to talk to the patients, you're going to chip away maybe at some of the fear and some of the lack of knowledge. You're going to maybe work to empower them some, and then also encourage them to also seek additional care. I just have here some of these fees for some dental procedures, and I mean it is very prohibitive. It's very expensive. But the flip side is that although dentistry is expensive, prevention is very inexpensive. And so for every $1 prevention, you could save $8 to $50 in restorative and emergency treatments. So prevention is the education and improving access early, and that's one of the lanes that you're going to be in. Patient education, about healthy diet and lifestyle, at home oral hygiene, encouraging the client to see a dentist, but also encouraging them to get support for the other aspects that might be affecting their oral health, which we will go into some of those. So, education and empowering the patient, $1 versus $8 to $50. So it's very important work what the community health worker can do. And that's why I can consider you all change agents. And the American Academy of Family Physicians also encourages the community health worker to work and integrate and work together and be a part of the oral health team for early detection, which we're going to go over, assessment, education, and for referral. The integration piece I like to talk about a little because, well, now that we've shifted our thinking and we're not so much thinking just send this person to the dentist, we're now thinking social determinants of health. We're thinking oral health. Now we're now thinking education. We're thinking empowering. We're thinking collaborating. That's the first level of integration of oral health care. A lot of people think integration of oral health care is just getting them to the dentist. But so much information is lost if that's how we think, so narrow, in such a narrow way. The first step of integration is you meeting with the patient, doing a kind of a basic assessment, which we'll go over, noting in their records so that you can see if there's any changes and in their oral health status. You are the first step. We're down the chain. The dentist is down the chain. The other thing of integration is by doing an assessment, you're going to be integrating because you're not just going to be referring to the dentist, but you're going to maybe pick up some other things which they'll share, such as mental health issues or stresses or nutritional issues or physical issues. And so you're going to also be integrating that because you're going to be referring for those things as well. Now, just to give you a little snippet, the 90-second smile protocol is really, it seems simple, but there's really a lot of good information you could get from the mouth by looking at it in this way. And then at the end, from what you have found, you're now going to be able to educate or coach that person and refer them at another level, not just oral health, but maybe some other things they need that's going to help support their oral health and their overall health. So you're going to integrate as well. So we're going to go through each of these, but it's S for symmetry, M for mouth exam, which you're going to do not with a going in there with a mirror, but if you feel comfortable enough at some point, then I would encourage you to do that. But these are simple things that you're going to be just learning to observe. Inflammation is something you're going to look to see, and we'll go over that. Inflammation causes loose teeth, which that's something that you might be able to spot. And then and from these things, there'll be some red flags. And here again, you're going to use that information, educate, and refer in a more holistic way. Okay, so let's start. So S is the smile. Now, and that's the symmetry. Now, that's something that you can see. That's something you could see from as soon as the patient comes in, or you have a virtual visit. As soon as you meet that person, you might notice that their facial structure is not balanced. Maybe it's a skeletal problem. Maybe they were in a car accident. Maybe it's things that you need to hone in on. Maybe it's this child has a bad infection. Okay. Maybe it's a sign of abuse. And women, domestic violence survivors, a lot of them have facial trauma. So you might notice, and if you've made a note, you might notice that. Maybe the first time you saw Miss Jones, you didn't notice that. You noticed everything was balanced. Maybe now it's not. What does that mean? If you see a child and you see a swelling, and then you see the child again, it still has a swelling, child neglect, or if the child has the swelling, you're asking the mother, does the child have a dental appointment? What else is going on with this child? So you're going to, immediately, just from not even, you don't have to look in the mouth. That might tell you some things. Yeah, maybe they do have a skeletal deformity. Maybe that's something that requires follow-up kind of medical care that you would want to know about and help support them in. So first off, you're just looking, just a broad view. Okay. Then after that, okay, you're going to, as they're talking, you're going to start looking at the mouth. Okay. Now I put this picture of the teeth, which you're not going to be remembering all of that, but I'm sure you recognize the front teeth and the back teeth of the molars that you chew on, and the eye teeth that we say are the canines. You use those for tearing. So each type of tooth has a certain purpose. So things like when the person is talking, or they might even share, you might ask them, do you have bleeding gums? Do you have any problems? They might say, my gums bleed. Or in talking, you might notice redness, okay? You might notice from talking, I know you can notice missing teeth, when you're talking. They might have a breath odor, okay? They might say they have pain, but you're going to just get a basic kind of, status on this person. Does the mouth look like it's healthy just from my standpoint of me talking with the person? Things like cavities, you'd be able to see too. You'd be able to spot. Okay. This second picture here, this kind of was similar to a patient that I saw that came to me. He had a beautiful smile, and the next year he came in and his mouth looked something like that with a lot of cavities. What was it? It was drugs. When I looked at him, and he knew I knew something, and we had a conversation about dental, but we also had a conversation about substance abuse. And so if you note in the records of your patients, the basic oral health status, again, if they are, you'll pick up maybe if they're beginning to run into trouble. If Mr. Jones had a beautiful smile like my patient did, and the next time you see Mr. Jones, you see, white stuff on his teeth that he's not brushing, or you see cavities, that's a change. That's a change. That's a red flag. It's not a good change. In children, certainly, when you see all of these cavities, they call it baby bottle caries, because many times the mother will put the bottle with juice or something like that, milk, and it'll sit in the poor child's mouth, all night, and they'll end up with something like that. Another thing you could think about too is nutritional issues. If this person that you're noticing, that you're assessing, doesn't have some of these other problems, it might be that their eating habits are terrible. So that might be a red flag just to consider. Maybe, are there other things going on with this patient that maybe they need a nutrition evaluation, if they have other things going on. Other things you might notice are broken teeth, um, eating disorders. You may not notice so much, but I'd like to bring it up because if you do have patients with an eating disorder, that can be very damaging to the teeth. The acid from them, if they regurgitate a lot, can actually eat away at all the enamel, and they might have sensitivity and pain. Okay. But things like dentures, does the patient wear a denture? Does the denture, when they're talking, is the denture moving? Is the denture in there properly? Because dentures are directly connected up with the nutritional status of our patients. And if they have a lot of missing teeth, or they're not wearing their dentures, there's studies that show that they more likely to be nutritionally deficient. And especially when it comes to seniors, we don't want that added on top of everything else. So, are they wearing a denture? And if they're talking, you see the denture moving, or they say I have dentures or I don't wear them, that's a red flag, because we want to support them to make sure that they nutritionally are okay. Other things you can look for in the mouth are the tongue. When they're talking, is the tongue, does it look moist, or do you think this patient might have dry mouth? Is the tongue does it look like this tongue with a lot of lines? That's a very dry tongue. Things like you might see in the mouth, besides you're noticing the saliva as they're talking, you're noticing the tongue as they're talking. You might notice, are the teeth chipped? Because people who are under a lot of stress a lot of times grind their teeth. So are the teeth chipped? Okay, so this is all information that you're picking up just as they're talking. And there'll be some things you may note, because you want to make sure that new things don't develop as you establishing your relationship with your patient. Now, once you kind of done that overview of things you can right off the bat, then I would say you would want to look to see if you see any red gums. If the gums are red, or if this patient says their teeth brush when they bleed when they brush, then that's a sign of inflammation, and that's a red flag. The bacteria in the mouth that causes this inflammation is the bacteria that's affecting the heart. It's that same bacteria that can affect the kidneys. It's been tied to respiratory disease, the preterm, the low birth weight babies. It's that bacteria in the mouth. So as we're talking to the patient, and maybe asking a few questions like, do your gums bleed? You're looking for that because that's a red flag. And as I was sharing, it's a red flag because it's tied up to so many things in the body. And the diabetes connection, once you see that inflammation and you've got a patient with any chronic illness, diabetes, heart disease, any of those illnesses, red flag, okay, that they are to be, of course, referred to the dentist, but might need to be referred to their primary care doctor or their specialist to make sure they're in compliance with all their medications and everything. If those two are managed together, they have a much better, the survival rates of patients with chronic illnesses, it improves tremendously. As I was sharing, the inflammation in the mouth is connected up to a lot of very serious conditions, and educating, informing is a key way of lowering that risk of this inflammation. Once you kind of getting comfortable, you're looking in the mouth as they're talking and asking a few questions. This inflammation, what happens if it's left and it's not treated, and the patient, for whatever the reasons, whatever the barriers they have, are not successful in controlling it, not only will their medical conditions get worse, but the inflammation and the problems in the mouth get worse, and the teeth will become loose. And I bring up this about the loose teeth because that's really a very advanced sign of gum disease. And things like end stage renal disease and your diabetics and your heart patients, I mean, the risk of those conditions getting worse just skyrockets. So here again, with the information that you have, you really want to try and share that with the patient and hopefully get them over the hump of following up on their care, not just for the mouth, but for the physical, the medical conditions that they have as well. It all goes together. Now, once you have gone through looking, the basics of the mouth, and as I said, this type of assessment you could do as you're talking with the patient, okay? And you're gonna get comfortable with it because we're not expecting you to look for special lesions and diagnose things and things like that. You're just looking to get a basic baseline of these factors that you see. And you can, even if you get comfortable with your patients, ask them, do you want to lift your lips so I can take a look and see how your smile is doing? And then you can really see. And once you have a comfort level with your patients, that's something that would be a next step, and that'll be it. You'll be able to see a lot. Okay. Now, once you've done that, now you're ready to educate or start coaching this patient based on their history and based on what you've seen. Now you can start talking with them. The first thing it will do sometimes is help lower their fear, which is a barrier, because you talking to them and you have a rapport with them, they might listen to you. They might grasp a little bit more that, just for your basic checkup and the basic to see your doctor again, that's going to make a big difference. And then once we get them, we can take it from there. But that, as I was saying, that first level of integration starts there, and you're increasing their awareness, and then you're helping to empower them so they can embrace some of these protective tools that we'll share, and on their own, like Lisa, start seeing improvements, and they really start getting into it. The oral health coaching is what you're going to be doing, talking with them, water, encouraging no soda, no juice, water. Xylitol is a sugar substitute, that the picture is there, is a sugar substitute. It's very protective of the mouth. And it comes in gum, it comes in hard candies. You could get it in the powder form, like Splenda, you could cook with it. And it's very protective of the mouth. And for a lot of people, and it's got a nice sweetness to it. So for people that like to chew gum or like sweets, this would be a good substitute for them. Now, this is all in addition to, of course, brushing and flossing, but these are some added things, okay? Oil pulling is something where they commonly use coconut oil. This coconut oil has been shown to lower the bacterias, the bad bacterias in the mouth. A lot of people like to use mouthwash, Listerine and things like that. The thing with that is that Listerine and those type of mouthwashes kills all of your bacteria. And the mouth, just like the rest of the body, is a balance of good and bad bacteria. So we don't want to kill the good bacteria. We just want to crowd out or kill the bad bacteria. So oil pulling has been shown to be very effective in killing off the bad bacteria. So with some oil pulling, you're brushing and flossing, some water, xylitol, they're off to a pretty good start. Stress reduction techniques. If you're noticing and you hear from your conversations that the patient has had some stresses, you're noticing maybe chipped teeth or teeth look ground away, you could talk to them about maybe considering, some stress reduction techniques, deep breathing, meditation, these types of things. And that also could make a big difference in their oral health. And then you're going to go to the next level of your integration now that you have given them some basic tools. And I could certainly share with you information if you like. But then you're going to go into the other things that you've noticed. You're, of course, going to refer for oral health evaluation. But does this person need to see a nutritionist? Does this person maybe need to go back to their primary care doctor for diabetes management or check the heart again? Does this person seem like they need a little bit of mental health support from what they've shared, from what I've seen in the mouth, it looks like maybe they're having a little depression. So that's the other level of integrating that you're going to be able to do by just focusing a little bit on the mouth. Okay, now I went ahead of myself there. Okay, so now after you've done that, you're starting your education, educating the patient. What you have to think about now is, all right, I now I need to get them off for all the support they need. And I know in some communities, it's very hard to find oral health providers that either take the insurances that our patients have, or maybe there's these providers are really far away, or maybe there's just not enough of them, in your community. I should say that that's another reason why you educating the patient and hopefully empowering them is so important. Because even on a good day, even if there was 50 trillion dentists around, the patient is really the one that manages their oral health. You see the dentist once a year, maybe twice a year. The rest of the year, it is up to the patient. And so this education piece is so important for them keeping their oral health good and also preventing them from getting anything, creating an issue. And especially if they have limited health insurance or there's limited providers in the area. You want to give them as much information, as you can to hopefully get them to understand the importance of the connections. But then I would say really try, your best to identify in your area those oral health providers that you could rely on. Community health centers are excellent resource, but you're reaching out in your community and finding, creating a list of oral health providers, reaching out to them saying, hi, I'm Ms. Jones, a community health worker, and I'm going to be sending people from me from time to time, something like that. You could also give your card to the oral health practice and say, if there might be some patients that might need the services and support that you're providing as well. The warm handoff, especially for these patients that have these red flags, your diabetic patients, patients that you've seen the mouth really start deteriorating, your chronically ill patients, your high risk patients, patients you see that you've seen for the first time and you really see serious problems. The dentures are loose. A lot of those people you may want to do a warm handoff if you've established a relationship. Just calling in beforehand and saying, I have Miss Jones, she's really, struggling, and I just want to let you know I'm sending her your way. Or you can say, I have Miss Jones here with me, and I would like, to set up an appointment, or she wants to set up an appointment. So you are like really driving this bus to get that patient, not just the education and the that you're providing, but also getting all the support they really need. Um, these types of trainings that you're doing, getting as much information as you can on all the connections that the body has, and certainly the oral health connections. And in your area, if there are oral health presentations or workshops in your community, you might go and try to meet some of the providers, some of the dentists, and you might find people in your community that you didn't realize were there. Um, there's the card, which I encourage you to download, because this is your first step in really feeling comfortable in assessing. As I was sharing, there's a lot of assessment tools out there for all types of people. A lot of them having to do with children, and you might have heard of Smiles for Life. They do a lot with fluoride varnish, and that's for children. There's assessments to help nurses in nursing homes and all these types of things. But a lot of these assessments really require that you really have to really be in the mouth, looking for how much plaque they have and things like that. And, for a person that's not a dental professional, I mean, that's it, that would kind of be prohibitive. I think, people, fear levels, you would not want to delve into that. So this shows you that there's a lot that you could learn from the mouth and not have to have them in the dental chair. And that this information that you're providing is really going to provide you with very beneficial information for you and for the patient, and that you can really effectively educate this patient, make these referrals. But you can also be managing this patient better, because if you're noting each time you see them, you will also be picking up early on things maybe they're not sharing. So, and in this way, yeah, I want you to encourage everyone to take that step if you're not already looking in the mouth, but take that step to consider that the oral health is not just send them to the dentist. It's what can I learn from this person's smile that's going to help me to help them. And that's any questions, send them my way, and can certainly provide references for you. Thank you.